LANAP stands for Laser Assisted New Attachment Procedure, and it's done with an Nd:YAG laser. It's a laser that was made to specifically kill the bacteria that causes gum disease. So instead of cutting with a scalpel, laying a flap, cutting gum tissue, grinding on bone, we're able to kill the bacteria more effectively that's causing gum disease. And we're doing that in 2 phases of the laser use, and we also go in there to debride all the root surfaces to make it smooth and remove the buildup. And then we monitor the patient 1 week, 3 weeks, 6 weeks, up to a year to watch their healing process. The procedure takes us about 5 hours to do, and we do the full mouth at once if the patient can handle that, so that the bacteria doesn't transfer from one side to the other. Traditional periodontal surgery is done half arch at a time. Most of our patients, if they had one side done, would say, I'd rather lose my teeth than do the other half. In terms of LANAP, there really is minimal recession, and we're not cutting away any tissue. So pain-wise, I rarely have to prescribe anything other than asking them to take Tylenol and Advil. Usually we do it on Fridays, and by Mondays they're fine. If I do a post-op call on Saturday, they say they're fine, that they are not having any discomfort. So it's a wonderful procedure rather than the traditional way of cutting and sewing.